On the short list of things I wish I knew when I was a physician assistant, either in the hospital days, because my background was 8 years of internal medicine in a hospitalist capacity. So I did things from working ICU to what we call med surg floors, which is people with pneumonia or new diagnosis of cancers or kidney failure, to rehab facilities where post hip fracture and surgery, we'd rehab you back to health. Or the ER, or what we would call the admissions team, where we would after you were stabilized in the ER, we would then take you upstairs to get your treatment if you needed to have an inpatient stay. I kind of saw it all, did it all within a hospitalist capacity before I jumped out into functional, integrative, regenerative medicine. And in that space, I became aware of so many more tools that I did not know were available to the American public to help us get well in our health journeys. And often things that don't break the bank, that are simple, safe, pretty much. Well, they should be safe, or I shouldn't be prescribing them to you. And we're very gentle on the body with minimal side effects is probably the best way to say that, or the least amount of long-term consequences. So one of those things is what I have here in my hand right now. This is an Oxytocin nasal spray. Oxytocin, really? Like really, Richelle? The thing that they put in a drip bag in an IV called Pitocin? Yes. But at higher doses to induce contractions in labor, it's like, my God, why would I put this up my nose as a female? There might be some that said, that's just a whole new level of trauma, right? Well, oxytocin in a much lower form, in a powder that's been reconstituted into a nasal spray, is such a godsend. For females in particular, males, yes, you can use it too. No, it will not make you lactate because oxytocin also is known as the love hormone. Females, after you deliver and give birth, you have an overabundance of it from your pituitary gland that helps you socially bond with your child, but also produce milk or lactation. But yes, no, male and female, you will not get lactation side effect if you use it in nasal spray form. Reconstituted powder into a bottle like this, little 8 milliliters, about 12 international units to 16 international units per spray. What can this be used for? It's definitely not the Pitocin that's in the drip bag that induces uterine contractions for you. So what we use this for, interestingly enough, number one, migraines, female and male, preferably with females. I have seen this work so much better than the triptans, like sumatriptan. I have also seen this work, especially in one case where I had a female who had migraines that were so debilitating, she couldn't get up off the couch. She was actually on disability, and she was on all the big gun drugs, so even the upgrades from the triptan class. Oxytocin got her up off the couch, which was fascinating. But oxytocin works in multiple ways. One of them is to decrease neuroinflammation. The other one is to sit on a receptor in your brain that stops the release and dumping of calcitonin granules, which is a trigger for migraines. And so whenever anybody says to me I have migraines that are unrelenting, or they're a new onset, or I've tried the triptans, they really don't work for me, but I don't want to go on the higher grade drugs that are going to be more expensive, have more long-term consequences potentially to your immune system and fertility. So they want to try something else, and oxytocin's a really good, safe bet. Now, oxytocin used in nasal spray form can be used to abort migraines. It can also be used to do maintenance therapy when it comes to migraines. And so there's different ways of application when it comes to using this spray. But I have found this to be so advantageous for women, especially who have migraines. Men, yes, you can use it too. But let's talk a little bit about the other conditions that you can use oxytocin for. Let's talk a little bit about some of the side effects, risks, a little bit about the contraindications perhaps behind using oxytocin. And then let's see if this is something that applies to you, because it's pretty inexpensive. It does have a 35-day shelf life though. That's the only kind of caveat you need to know, generally speaking, with an oxytocin nasal spray. And then let's talk about oxytocin in general, because there are actually other applications of it sublingually that can be good for sexual health and your own intimacy journey. So we'll stop this video here. We'll talk a little bit more in the next one. But oxytocin, one of the things I wish I knew when I was a PA back in the day. I think this would have helped people in a very advantageous way in their health journeys moving forward.